Hi, we're Lifeweavers. My name's Liz.
And my name's Iona.
Lifeweavers is a healthcare consultancy with a big passion for occupational therapy based in Singapore. We have witnessed that occupational therapy is often underrepresented in many areas of healthcare. So we have a mission to advocate for the far-reaching benefits of occupational therapy in both preventive and reactive healthcare. The occupational therapist's unique understanding on the interaction between person, environment and occupation is essential for maintaining and promoting health and well-being in our ever-changing world.
Okay, so Liz, what are we going to talk about today?
We're going to talk about occupation, what is occupation and occupational therapy. We're going to do some OT myth busting, talk about the Lifeweavers OT process, who we work with, and finally how you can ask for an occupational therapist.
Okay, so first we want to talk about the word occupation in occupational therapy. I find that the word occupation can often be confusing, so let's clarify. If you look in the dictionary at the word occupation, you'll see that it means employment, it means occupying a space, or even occupying a country. When we talk about occupation, we're not referring to those things. So for us, occupation is the things we need to do, the things we want to do as part of everyday life. That is the way in which we occupy our time. So we can break occupation down into three key areas. So the first area is self-care. That can include personal hygiene, such as showering. It might include dressing or preparing a meal. The second one is productivity or work. So that might include your job, volunteering, domestic chores, or for children, going to school to learn. The final area is leisure. So that includes hobbies and interests, play skills for children, and socialising.
For example, my meaningful occupation would be styling my hair, because I'm the only one who knows how to do it right.
And for me, a meaningful occupation would be yoga. So something that I see as a bit of a crossover between self-care and leisure, something that's good for my health and something that I really enjoy.
So have a think about what occupations are meaningful to you and imagine what would happen if you couldn't do them anymore. How might you feel?
So I'm going to give you an example that I dislocated a finger recently, which meant that I couldn't do yoga fully for a few weeks. So I felt less productive and less satisfied. I lost strength and I felt that something was missing from my routine. Okay, so what is occupational therapy then? So as occupational therapists, we focus on helping people to do occupations that are important or meaningful to them. So as occupational therapists, we view humans as occupational beings with an innate drive to act and to do. And we view occupational therapy as unique. So we believe that occupation is fundamental to health and well-being.
So as OTs, it's our role to look at the barriers to your occupations and see what do we need to do to get you doing them again.
Okay, so we're going to move on to some OT myth busting. Okay, so occupational therapy is often misunderstood. So to help us explain OT further, let's talk about some classic misconceptions. So the first one would be that an occupational therapist's role is to help you find a job.
So we've already explained that the word occupation in the context of occupational therapy means so much more than work. We are not careers counsellors. However, if you do have a physical or mental barrier that is preventing you from maintaining or returning to work, we can help you address those, as long as it's meaningful and purposeful for you and it's part of your therapy goals. So let's move on to myth number 2. An OT is just a glorified physiotherapist.
Okay, so we're aware that there's often some crossover and some confusion between the role of an occupational therapist and a physiotherapist. So from our perspective, a physiotherapist focuses on performing movement of the human body, exercise and mobility. For occupational therapists, they focus on purposeful and meaningful occupations, doing of activity and enabling you to engage in activities of everyday living. Okay, so myth number 3. Occupational therapists only work in hospitals.
Incorrect. We can actually work anywhere that's meaningful to the patient. Therapy might start in hospital if the person is recovering from an injury, but we can also work in the community, providing services directly to the person's home or in clinics. We can also do lots in the prevention services, helping people stay well at home and out of hospital. So, myth number 4. OTs only work with children or people with hand injuries.
Okay, so we want to clarify that we actually work with people of all ages who are experiencing difficulties in functioning that are interfering with day-to-day activities. So there are different specialisations in occupational therapy, so that might include managing trauma, mental health, geriatric, working with seniors, stroke rehabilitation, returning to work, and these occupational therapists are based in the hospital, they're based in clinics and the community. So the final myth, number 5. So occupational therapists only do arts and craft or boring and repetitive activities.
OT uses occupations that are purposeful and meaningful to the individual as part of the therapy. So if you used to be a lover of art, but an injury has gotten in the way of doing your day-to-day activities, we might use art as a tool to help in your rehabilitation. For example, if you have lost strength or stamina in standing, we might use an activity standing at an art easel to increase your standing tolerance. However, if you absolutely hated art, we wouldn't go down that road. We might use something else to improve your standing, say interactive computer game that you do in standing reading, standing cooking, anything that's of interest to the person. So to summarise, OT focuses on purposeful and meaningful occupations, things that you want to and need to do, addresses barriers to engaging in activities, and believes that meaningful activity is fundamental to your functioning and well-being.
Okay, so next we're going to move on to talk about the occupational therapy process. So if you see an occupational therapist, what's actually going to happen? So first off, you're going to have an assessment. So that means that we'll start with a comprehensive initial assessment. And this assessment is going to be person-centred and done in partnership with you. It's also going to be holistic, so that means viewing you as a whole person, so not just viewing you as a diagnosis or an impairment. So this is the point when we really get to know a person, their occupations, the environment, and what barriers they're facing.
So next we go into goal setting. This is where we set goals that are important for the person. We help make sure that they are achievable and realistic, and then we start to plan an intervention based on achieving these goals.
So next we're going to move on to intervention. So this is where the therapy happens. And the therapist is going to help you to address occupational needs and barriers. And this is where we may focus on the doing and the actual participation in activities. So this might involve completing a program of one-to-one sessions or group sessions. This might mean modifying your environment. It might mean practicing self-care skills. It might mean learning to use equipment to improve your independence, or we might use some therapeutic activities that help to rehabilitate you, to increase your confidence and to reduce isolation.
And during this process, we will plan reviews. This is where we have regular review sessions to check on progress and make sure that we're on track to achieving your goals.
And finally, we're going to wrap up. So once your goals are achieved, you'll receive an occupational therapy report. And if new occupational therapy goals are identified, then we might start the process again, or your therapy may come to a natural close.
So that's what we call the OT process. Let's have a look at some examples. So I'm going to give an example of a person with Parkinson's disease. So a person with Parkinson's might have difficulty initiating and controlling movement, which might cause problems with balance and cause them to fall. So an occupational therapist would look at the environment and see if it can be modified to support the patient better. We might also help the person understand their condition better and how medication timings affect their function. We may also teach the person about falls. We would be doing falls education. Perhaps we'll teach them how to fall well and get up from the floor again.
Okay, so I'm going to give you an example of a person with depression. So depression is characterised by persistent low mood, and people with depression often feel unable to carry out everyday activities as they can find them to be overwhelming. So they may not care so much about their personal appearance or hygiene. They might lose interest in their social activities. So an occupational therapist can help the person to explore their difficulties with low mood and motivation from an occupational perspective. And they can help you to restructure your daily life, find meaning in daily occupations, and restore self-efficacy. So that is the belief that we are capable of succeeding or doing something. Okay, so to summarise, if you have a physical health problem or a mental health problem that is interfering with your day-to-day activities, that is the things you need to do and the things you want to do, then an occupational therapist can help you. What we want to do is emphasise today that the most important thing is that you know what an occupational therapist is, what they do, and how to ask for OT.
So, OTs can help with
environmental modification,
recommending and trialling equipment,
improving self-care skills,
improve skills and confidence for work,
skills for living independently,
safety in your home and community,
social skills and developing interests, training your carers.
and we can work with anyone at any age. So now you know more about OT, how do you get one? You can ask your doctor, ask at the polyclinic, ask at schools, or ask at AIC. You can also ask us here at Lifeweavers. The bottom line is getting your life back. Illness and disability does not mean that you cannot have aspirations and do the things that you want and need to do in your life.
Okay, so thank you for listening, and we hope that you've learned a little bit about occupational therapy and the ways in which we can help you. My name's Iona.
And my name's Liz. Goodbye.
Bye.